Hi guys, welcome to my YouTube channel. My name is Crystal and thank you so much for tuning into Tally TV. Today we're going to talk about a very sensitive topic, polycystic ovary syndrome or polycystic ovarian syndrome, PCOS, Pcos, whatever you want to call it. I'm going to talk about that today and my journey through that, how I became pregnant with polycystic ovarian syndrome. This is going to be a part 1, part 2 series, so stay tuned guys, you don't want to miss this. Welcome back. All right, so we're going to talk about polycystic ovarian syndrome, polycystic ovary syndrome, PCOS, All right, so polycystic ovary syndrome is the most common endocrine disorder among women of reproductive age in the world. Right? For shorter, Pcos, it means polycystic ovary syndrome. What causes Pcos? Well, presently, the exact cause of Pcos is unknown, but some experts lean towards the theory that it might be genetic. It could be an inherited condition since women who have it are more likely to have a sister or mother who also has it. So most feel that women with PCOS have a defect in insulin or insulin secretion that leads to the disease. That is why women with PCOS are more likely to get diabetes. Yeah. Now, who can get PCOS? Anybody. Any woman, that is. So PCOS normally affect women once they start having menstrual cycles or hit the age of puberty, right? And this happens like typically around age 11, 12, around that age group. Now, another question that another person's asked, can PCOS affect your chances of getting pregnant? It might, because you have to remember that it's a hormonal imbalance. And what it does, it hamper, with the normal ovulation and cause female infertility as well as subfertility. Now, another question that most females ask, is there a cure? There is no cure at all, period. There's no cure. Now, it can be managed with appropriate treatments, right? So whenever you go to your gynecologist, once you're diagnosed with this condition and you go to your gynecologist, they can give you the best treatment, to combat this condition. And that also depends on your symptoms, but it's not a cure. Now, weight loss might improve the symptoms in a lot of women with PCOS. And it does, because women with PCOS, we gain a lot of weight, and once, remember that PCOS affects the entire body, right? And when you're losing weight, you can also lose your hair, right? You can also lose your hair once you're losing weight. I don't know what caused that, Most women with PCOS will get discoloration of the skin. So sometimes you will see around the neck back here black, and most people will be like, them now wash them neck. Honestly, they have a condition. Now you know. And also for persons who have severe polycystic ovary syndrome, have whiskers, moustache, chin hair, here in the chest, and here on the buttocks, right? Go get yourself checked out. It's not normal. People in the country will say, girl, you're strongy. Come on. It is a condition that needs urgent medical, it needs to be looked at, right? So don't take that, oh, you're strong, as a compliment. You need to go to the doctor and get yourself started out now. If you experience growing chest hair, growing hair on the buttocks, having hair at the side of your face here, what they call whiskers, going down beard, chin hair, mustache, let me tell you something. Don't let nobody tell you, oh, you're strongy, you're strong. Come on. Something is wrong. You have to go to the doctor and check that out. It's not normal, right? So don't take it as a compliment. Let your doctor check you out and put you on medication as soon as possible, right? Don't wait until things get worse, please. Some women may not have the hair growth, may not have the whiskers, may not have the mustache, may not have the chin hair, but have acne. And these are severe acne I'm talking about, right? So we understand that. Now, how is polycystic ovarian syndrome diagnosed? Now, when I was diagnosed, I had to do a blood test. What the blood tests do is to check the levels, the FSH and the LH. Those were the two levels. The FSH and the LH, now these are the hormone levels, right? Now, they are often in the range of 4 to 8, and this happens in young fertile women. In women with polycystic ovarian syndrome now, or ovary syndrome, the LH to FSH is often higher. So for example, you have a 2 to 1 or even 3 to 1. With Pcos, doctors often see the FSH in the range of about 4 to 8 as well, but often the LH levels are 10 to 20. Ridiculously high, man. Those were the two hormone levels that they look at, right? So the diagnosis of polycystic ovarian syndrome, they have to do a series of blood tests, right? Then they will do a vaginal ultrasound, and because of elevated testosterone levels, right, in the female body, hence the reason why the female grow the beard hair, chin hair, mustache, and they will pick up the PCOS on the ovaries by using the ultrasound. That's how they will diagnose you. They will check on your hair growth. They will check on your menstrual history. They will do a screening test for diabetes, endometrial lining, and more to treat your PCOS. Doctors will do that. Whoever you go to, whichever gynecologist you go to, they will go in depth to let you, be at a stage where you're comfortable with this. They will find the best treatment for you, so that you can, get back on track and manage your symptoms well. All right, so if you have PCOS, there are certain medical problems that you are at risk for hypertension, diabetes, endometrial cancer, gestational diabetes, sleep apnea, anxiety, and depression. Now, if a woman is overweight, will losing that excess weight help her to become pregnant? This is a question. I'm gonna answer it. In most cases, it might, but there's no guarantee that it will. Now, it is possible that weight loss could help in reducing insulin resistance, which could result in ovulation or improve ovulation. So this could help with conception as well. So normally doctor says, like, they will tell you losing 10% of your body weight could be enough to improve symptoms, which is true. It is true. But how much exercise you have to put in? Yeah. My doctor did tell me that though. He told me that doing 30 minutes every day is good enough. Even 30 minutes walking is good enough. That can help to reduce the amount of insulin that the body produces. Now, medication that can help you. So you have Clomid. You will have, and Clomid actually allow you to ovulate, right? Letrozole, which is a breast cancer treatment, can actually stimulate the ovaries too, so you can ovulate. This is something that once I was pregnant, I thought that this could happen to me. Is it true that pregnancy cures Pcos? It doesn't. It doesn't. When I did my research, I realized that it didn't. It doesn't cure PCOS. Now, it is very common though for a woman with polycystic ovarian syndrome to have a cessation of symptoms while she is pregnant, and many women have improvements to a normal menstrual cycles after having been pregnant, right? Now, PCOS can cause problems if you are trying to conceive. It can cause problems. But this is it now. Listen. But with the right treatment, you can conceive. So when you go to your gynecologist, you go there and ask them, what's the possibility of me conceiving with polycystic ovary syndrome? They will definitely tell you, right? They will check you. They will prescribe different medication for you, that would work. And
when I was diagnosed with polycystic ovarian syndrome, I was on metformin. They give me that. It's a diabetes drug, but it does help to regulate your periods. And I was on folic acid, prenatal, omega-3. I was taking some iron tablets as well, because I was bleeding for 6 months straight, non-stop. So 6 months bleeding, right? And 6 months not bleeding. So didn't have a period for 6 months straight. Let me tell you something. I've gone through it.
I had to change my diet, right? From eating white rice, white flour, and I have to eat like a diabetic basically. So what I do eat is it's mostly basmati rice. It's like the golden rice. Every time I eat that rice, it gives me so much energy, right? I love it to the max. It gives me so much energy. I don't have I'm having regular periods. No, by the way, thanks be to God. Hallelujah. Yeah. And I had to change my diet. So the fast food, the KFC, I haven't had KFC for over 4 years now, even Burger King, so I have to, be careful what I put in my body. And when I was in high school, they talk about giggle, garbage in, garbage out. We learned that in IT. So if you put garbage in your body, you can end up getting sick. Just like if you don't know garbage on your computer, you can crash your computer. That's other thing. So we have to be mindful. We have to know exactly what we're doing with ourselves. Be careful what we consume. Too much sugar is a no, because when I first visited my doctor, she said to me, look, cut sugar out completely. Cut it out. You have polycystic ovarian syndrome. Cut it out. You can develop diabetes, and when I hear about diabetes, all I think about is that losing a toe, losing a foot, losing a hand. You know what I mean? If it's not properly managed. And I don't want to put myself into that situation, right? So it is just for us who are suffering with this condition to just be bold. Take the necessary actions, right, in allowing your body to be well. Pcos can be managed, but you have to do the work. Anybody stress you out, lower your stress level, and eat properly. If you don't have to fry your food, bake it. So eat right. Eat food that are mostly organic, and you will see the change. Take your vitamins as well. If you want to start yourself on prenatal, you can go ahead and do it, or folic acid. That will help prep your body, for what is to come, and don't worry about, will I be able to become pregnant? You have to believe in yourself and tell yourself that you can and you will become pregnant. It is possible, but you have to take care of you, right? Be open to your doctor, be as honest as possible, and find one that cares about your needs, because once you hit 30, remember there's a decline in your fertility, so the sooner you get jumping, it's the better for you, the better chance it is for you, right? But don't let anybody tell you that you cannot become pregnant. You can become pregnant with polycystic ovarian syndrome, polycystic ovary syndrome, PCOS, Pcos. You can become pregnant, right? So don't worry too much. Just do what you need to do on your end. Make sure that you have a proper diet. Do 30 minutes exercise every day. Walk. Even walking can help. Drink a lot of water too. So cut the sugary drink, cut the sodas. Many of us love Pepsi. Many of us love the ginger beer. I love ginger beer. I used to drink ginger beer like all the time. But can you remember when last I had a ginger beer? No, you know? So you have to take care of you, take care of your mind as well, because with this syndrome, it can bring on some mood swing. You don't want to talk to nobody. You just want to be by yourself, and that can hamper your relationship as well, so it, like I said, it is for us to take care of our bodies, take care of our mind, eat good food, right? Cut coffee if you have to, cut sugary drinks if you have to, cut KFC if you have to, cut it all, cut it out. If you wish to check on your if you wish to track your ovulation or the time when you're ovulating, that's fine. If you're ovulating, you can then have sex, sex day and night, night and day, sex. Now, if you're doing that and you're not ovulating, then your doctor will find the best medication for you, right? The first one, I assure you, that they will put you on is Clomid, right? And Clomid, like I said, it stimulates the ovaries and allow you to ovulate. So it kickstart it for you. Kick it, yeah. Give you a little kickstart. You start ovulating and you just have sex right away, right? So you will know when you're ovulating, trust me. You will know. That's not something you have to track. You will get all the feeling, all the heat running through the body. You will know, right? So we have come to the end. Remember to stay tuned for part 2. And thank you so much for watching. Please remember to like, share, comment, and subscribe to my channel. And also click the notification bell to be in the know. Thank you so much. And I'll see you next time.